So Elizabeth, you're on our legislature, and according to the bylaws, we need to have one representative from the legislature as a member. And so you are fulfilling that role for us. And I'm saying this because Christine Schuyler, our secretary here, is absent. She would normally be saying these things, but she became ill, so she's not able to come today.
Okay, thank you. So we'll begin the meeting with the privilege of the floor. We have a number of guests here this evening. I'll ask if any of you would like to speak.
Yes.
Please give your name and address for the record, please.
Yes, I'm Mark Twitchell. I'm a Fredonia resident. I appreciate the opportunity to speak before the board. The last time I was here speaking on this issue was in April of 2017. Since that time, of course, the New York State Department of Health has come out with its recommendation and guidelines for turbine noise, and I would like to submit that to the board. This is the testimony of Mr. Henry Sleethoff, who is appointed by the New York State Department of Health to publish the guidelines. And the second item that I will submit is a rebuttal to Mr. Sleethoff's methodology, the studies that he either chose or chose not to include in the establishment of the New York State Department of Health guidelines for turbine noise. So if I may, I'd like to place these on the desk.
Yes.
Thank you.
We will accept these for our records this evening.
And the next, before I present the other materials, I'd like to applaud the action of the board in joining the Western New York Public Health Alliance and expressing concern for the public health of New York State residents exposed to turbine noise. And I did have a question relative to that. If perhaps the communication that the Alliance sent to Albany, if it could be clarified such that we understood where the communication went. For example, if it went to the Public Service Commission, they're very receptive to citizen input. And I know that there's a number of citizens that would like to perhaps support or reinforce the statement that the Alliance made, if indeed there is, if that is an open possibility.
I do not know where that went. Does anyone?
Christine is a member.
Pardon me?
So Christine would appreciate that.
Okay. Chris, our public health director is not here this evening.
Okay.
She apparently is the one who would know.
All right.
Can we make a record to ask her, please? We'll pursue that. Public Service Commission is the appropriate place. Is that what I?
Well, that would be my question: is where did the Alliance send its communication? It perhaps went to an agency that is not accessible to the public, but the Department of Public Service does maintain quite an open forum for citizen input. So if it went there, then that would be, a chance for us to comment or contribute.
Yes, where did, yes.
Do you know the date of that communication?
I'm sorry?
Do you know the date of the communication?
It was published in the Observer, in the newspaper in Dunkirk, and that was probably, maybe 3 weeks ago? Yeah.
Just to make sure that when she asks you, she's
Mm-hmm.
making the correct one.
Right. It was also published in the press in the Lockport area because of the concern in that part of Western New York for the development, the wind energy development that it's occurring there, and it because of the nature of the publication, it received quite a bit of attention on the web, so to speak, the various websites that represent different regions of New York State. Everybody kind of posted that and shared that with one another, but there remain some questions as to what was the intent of the communication. Was there an effort to amend, or in some way influence the New York State Department of Health's guidelines? Moving on, the other items that I would like to submit, I have a collection of letters from the residents of Arkwright who have been impacted by the noise of the turbines, and these letters represent the opinions and the experiences of people who have spoken publicly either at town board meetings in Arkwright or before the Public Service Commission hearing in Sinclairville, which was just a couple weeks ago. There is at least one other family that spoke publicly at both of those meetings that did not print or send a letter. So what that illustrates is that sometimes people are reluctant, and in the nature of the wind industry, many people that have been impacted have no doubt signed non-disclosure agreements, what they call good neighbor agreements, so that it's very difficult to find out the true nature of the families impacted. If people who sign those agreements are discovered, then they lose the benefits that the good neighbor agreement provides them. So these are the letters.
Okay. Well,
Thank you.
And
the letters.
I want to remind folks that for the privilege of the floor, there's a 3-minute time limit. Following the legislature rules, you're speaking on behalf of a group is 5 minutes. And I'm taking that to be the case here. So.
Yes, thank you. And this is my last item. When I was here in 2017, I presented to the board a bibliography of scientific articles and research studies and reports documenting the harm that people can experience from wind turbine noise exposure. So I thought it would be appropriate at this meeting to present an update of the materials that I had previously supplied. These are all studies and reports that have been published in 2017, but most of them are in 2018. And I just want to speak to the first one in particular, which is the World Health Association, which just a week ago published the long-awaited guidelines for public exposure to wind turbine noise. And they state, WHO states that, WHO states that 45 decibels is associated with adverse health effects, which is in direct conflict with what the New York State Department of Health has published. They are permitting 55 decibels, and the 10 decibel difference is actually a perceived sound level twice. 10 decibels is twice as high as what the World Health Association is now recommending. So
is that a logarithmic scale?
Yes, it is. Yes. Also, there's a couple of the articles that I'm presenting built upon a previous study, the Health Canada study, which has been discussed and debated extensively in the 2 years since it was published. And these are authors that participated in the Health Canada study, and they used some of the initial data from that study to fine-tune their findings, in particular related to annoyance and how annoyance is related to adverse health effects. So with gratitude, I will submit this updated list of adverse health effects.
Okay, thank you.
Thank you.
We'll accept all these into a record, and this is a particular interest of mine. And with everyone's permission, I'd like to take these home and review them over the next couple of days, and then get them back up here for other people's review.
I can go ahead and help the house here.
Okay. At least that last item. We'll take a look at it and see what we want to scan. Anyone else that would like to speak to the privilege of the floor? Seeing no one, we'll move on. Oh, yes.
I didn't know, it has to do with the wind turbine projects also. I didn't know if I can speak or, okay, it's
Yeah,
Joni.
please take 3 minutes.
Okay, Joni Riggle, I live in Sinclairville, New York. Would any state agency or health department allow the tobacco industry to set public safety standards for smoking? Of course not, but that is exactly what New York State and others have allowed for the wind industry. And Mark did discuss the WHO standards that they have proven that 45 decibels above that has adverse health effects. And there are numerous studies coming out. We're in the early infancy stage of really looking into the health impacts from these projects in close proximity to dwellings. Dr. Dan Driscoll was a 20-year former noise engineer for the PSC and DEC. He testified to NYSERDA that infrasound is a sound that you can't hear, but it passes through our walls. It's not attenuated, and it has very negative effects on the human body after prolonged exposure. Symptoms like headaches, dizziness, sleeplessness, nausea. He recommends at least a 1 kilometer setback. Our towns in Chautauqua County have adopted the wind industry standard of 1,000 feet, and that's a problem. The New York State Health Department admits that they are very short-staffed and inexperienced with industrial wind projects. Unfortunately, they have basically adopted the wind industry standards. The German Max Planck Institute did a recent brain MRI study. It's pretty groundbreaking. It's altered cortical and subcortical connectivity due to infrasound administered near the hearing threshold. The wind industry claims that what you can't hear will not hurt you. This study, this is one of the excerpts and findings. The researchers said since the brain's response to prolonged near-threshold infrasound involves the activation of brain areas which are known to play a crucial role in emotional and autonomic control, a potential link between infrasound-induced changes of brain activity and the emergence of various physiological as well as psychological health effects can be established. Transient upregulation of these brain areas in response to below or near threshold infrasound may thus reflect an initial stress response of the body, eventually promoting symptom formation as stimulation occurs repeatedly and additional risk factors may come into play. There are Portuguese researchers, engineers, and physicians in Dr. Piera and Castelo Branco have published in PubMed some studies on vibroacoustic disease, and I will leave you some of these recent studies that have been done, and that's in a preliminary stage also, but it shows fibrosis of tissues, lung tissues, cardiovascular fibrinogen from repeated assault with infrasound. Arkwright is at ground zero for our county. It's been a nightmare of invasive noise, vibrations, blinking, strobe lights. A lot of people complaining of sleep disturbance, headaches, nausea, vomiting, tinnitus, vertigo. 2 more projects are coming. They will have larger turbines and more powerful turbines. And we have the highest wind shear on the Chautauqua Ridge that these wind companies have ever monitored or found in their noise studies. And that creates the problematic whooshing, thumping, and increased infrasound levels. One other concern I do have is the vector-borne illnesses. I know there's a physician from Brooks that contacted me. He monitors and tracks the vector-borne for New York State. I know they recently just discovered the 2 West Nile virus cases in Chautauqua County, and bats consume at least like 1,200 mosquitoes per hour. They are critical for public health issues. And there's a new, what is it called? A new invasive species, a pest called the spotted lanternfly found in Pennsylvania. And they're really afraid that that's going to migrate into New York State. And bats would consume this pest also, and it attacks agriculture. It attacks our trees, grapes, hops. fruit trees, that kind of thing. These companies that come to work on Arkwright, they're all from Pennsylvania, Indiana, Texas, Colorado, Utah. I worry very much with them bringing in all their equipment that they're going to be spreading these invasive species. How
I'm
can
gonna
you
have to
help?
Call time.
Okay, thank you.
Thank you for your comments.
Thank you.
I don't know that we need to copy all of that, but perhaps we can get together and make some decisions on what to include. Anyone else that would like to speak to the privilege of the
My
floor?
name is Bruce Roll. I'm a resident of Arkwright. I just have a brief letter to share with the board about our personal experience in recent weeks with the activation of the wind turbine project. The essence of our Arkwright home has been destroyed, and there is no end in sight for the continuation of this destruction in Chautauqua County, western New York, and New York State. Arkwright residents are being sickened. Arkwright residents' entire families are being driven from their homes. The very people who have taken an oath to protect the health and welfare of the residents of Arkwright, the town supervisor and town board, have sold us out to big wind. They are not windmills. It's not a wind farm. It's not a wind park. There are 500-foot industrial wind turbine towers inappropriately and illegally sited in an AR1 agricultural residential district. There are 9 500-foot industrial wind turbine towers visible from our kitchen window. When the turbines were activated in recent weeks, we noticed unusual sounds inside our home. On one occasion, there was a sound like a jet engine nearby. Another time, there was a strong vibration, humming sound permeating the house. The onset of headaches coincided with these incidents. Our beautiful, healthy, peaceful, safe place to live has been sold for the promise of a few dollars, our own taxpayer dollars, no less. Thank you.
Thank you. Do you have a copy of the letter?
I will at the end.
All right, thank you. Is there anyone else who would like to speak to the privilege of the floor? Seeing no one, we'll move ahead with the agenda. Some of the minutes from the